Dr. Karen Kotloff, a pediatric infectious disease specialist at the University of Maryland School of Medicine, talks about her research into Staph aureus infections in infants in neonatal intensive care units.
Dr. Kotloff, can you tell us about what your study is about and what led to your interest in this topic?
I'm a pediatric infectious disease specialist, and we are consulted very commonly for serious infections with Staph aureus in babies staying in our neonatal intensive care unit, or the NICU. Staph aureus is one of the leading causes of serious infections in those babies, and it's associated with a high mortality. In some studies, it's been up to 12%. And we're very interested in learning ways to prevent those infections. And one way that has been proposed is to screen babies and anybody who's found to harbor Staph aureus, because normal people harbor Staph aureus in their nose and on their skin. And so if you can identify those babies, then you can separate them from other babies in the unit so that the staph isn't spread from child to child. Or you could even try to get rid of the Staph aureus by using topical antibiotics such as Mupirocin. And that practice is being followed in ICUs for both adults and children, but we don't know in the NICU whether it works and whether it's safe. Staph aureus is one of the leading causes of late onset sepsis in the neonatal intensive care unit. And late onset sepsis means sepsis that occurs when a child has been in the unit for 3 days or longer. And the burden of disease is especially high because this tends to be a very severe infection, and mortality is high. In some studies, it can reach 12%.
Can you tell us about your design and your methods, including any maybe special design procedures?
We conducted this study at 6 sites throughout the country, and these sites participate in a network called the VTEU that is funded by NIH. And at the neonatal intensive care units of these sites, we screen babies to see if they harbored Staph aureus in their noses. Many babies can have Staph aureus in their nose and live with that Staph aureus without having any problems, but in a small percentage of babies, especially very premature babies, it can lead to serious invasive infections. What we did is then we enrolled babies and we randomly assigned them to receive either Mupirocin treatment to their nose, to their umbilical areas, and to their perirectal areas, or no Mupirocin at all. And then we measured if there were any safety signals in treated children, and we measured whether the babies became decolonized, or the Staph aureus was eradicated from their nose or their skin sites. In our study, we found that between 11% and 44% of the infants who were screened were colonized with Staph aureus. And that's really high, and it shows that there's a lot of exposure in the unit. And we also showed that, for example, in the control group, so when children weren't treated in our study, 5% of them went on to develop clinical Staph aureus infections. So considering the severity of those infections, that also speaks to the importance of this as a problem for these babies.
Can you tell us about your main findings?
I think that the strongest finding from our study is that Mupirocin treatment can eradicate colonization during the first 3 weeks after colonization is detected, and that's probably the highest risk period for getting an invasive infection. Our study also suggests that if longer-term protection is needed, that this strategy would not be effective, that other strategies would have to be evaluated.
Visit our website to learn more about our research at the University of Maryland School of Medicine Center for Vaccine Development and Global Health.